Hey guys, my name's Ali Popoff and I'm the owner of Powered by You CrossFit West Kootenay. Today we're here to talk about
injury prevention for knee pain.
first thing to start off our knee program is making sure that we loosen up all the muscles around the knee joint. The first one is going to be alpha ball rolling, lacrosse ball rolling, or foam rolling around the base of the knee. I like doing this with the thigh flexed so that the leg is, or the knee is bent to 90 degrees. Whatever variation you're doing, you could sit here for anywhere from 60 seconds to up to 3 minutes. As you're rolling, if you find a super sore spot, just stop, relax, and try and release the muscle into the lacrosse ball, the alpha balls, or the foam roller. Make sure that if you have knee pain on the left side, that you do the other side as well. Once you've completed your alpha ball rolling on your knee, you're gonna move down to the muscles around the knee, which are gonna be the tibialis, the peroneus, and the calf muscles. So the easiest way to get into the tibialis is gonna be foam rolling. So go up onto it. First thing you're gonna do is start in a 4-point stance. You're gonna have the foam roller starting at the top of the tibialis. The tibialis is the muscle that controls dorsiflexion, so pulling the toe up towards the knee. Now, Emily's gonna pull her knees to your chest, so bring your hips back a little bit, Emily, and she's just gonna very slowly roll up and down over the tibialis as slow as she possibly can. If you can handle it, using a lacrosse ball is gonna be a lot deeper, and if you do use a lacrosse ball, you just wanna make sure that when you get to those sore spots, you relax into the muscle as much as you can so that it can release. Once you've done the tibialis on both sides, you're gonna move into the peroneus. So Emily's gonna kind of sit on her side. Perfect. So peroneus is going to be through the outside of the leg. So we're going to put the lacrosse ball down. She's going to get the shin onto the lacrosse ball, and then in whatever range of motion and whatever amount of pressure she wants to put on it, she can. Same thing, if you can't handle the rolling, try to just relax and release the muscle around the lacrosse ball. If you get onto the foam roller or the lacrosse ball and it hurts a lot, it means that you need to be doing this. So start off slow, maybe reduce the time, go nice and easy, and try and get into those muscles. Once you've done the peroneus, I would suggest doing the gastrocnemius as well as the soleus. You can do this again on a foam roller, or if you can handle it, a lacrosse ball. When you find those trigger points, the areas that have a referred pain pattern, just try and relax, let the muscle relax around whatever your object or whatever object you're using, and that's going to be the most beneficial. Next area you're going to roll is the IT band. You can also get up to the TFL, which is near the top of the greater trochanter. This area is always sensitive on everyone because the iliotibial band ultimately stabilizes the knee towards the hip. So don't be discouraged if it hurts a lot, just go slow. And if you have knee pain, make sure that you're really focusing on the attachments around the outside of the knee. You would spend as much time as you could here, but a minimum of 60 seconds all the way up to 5 minutes. When you're doing any foam rolling or lacrosse ball rolling, you want to move slow and try and relax so the muscle has an opportunity to lengthen around whatever you're using. The next exercise that we're doing is just some really basic femoral rotations. Again, this exercise is going to help the joint pivot in the femoral head better, which ultimately is going to take more pressure off of your knees. All you need to do is lay onto your back, your arms are at your sides, palms up. Feet are going to be as wide as the mat that you're laying on, or just on the outside of your hips. All you're going to do for this exercise is rotate your knees to one side, allow them to relax dead weight, whatever that feels like for you. Then tighten up your core, come back to the center, and roll all the way to the opposite side. I would do this for about 20 repetitions each way, or until you start to feel like there's a little bit of a freer range of motion through the hips. Once you've done 20 reps each way, we're going to move into a few mobility exercises for the quads as well as the ligament of the knee. The first one is called a couch stretch. This is a stretch for the biggest part of your quad, the rectus femoris. So when you're getting into this stretch, you want to make sure that you have a nice pad underneath the knee. The reason why it's called a couch stretch is generally people will elevate their foot up onto the couch. In this situation, we're just going to get our knee down onto the mat and our foot up onto the wall. Now, when you're doing this stretch, depending on the mobility that you have through your legs, will dictate how close you're getting to the knee to the wall. If you're finding that having your foot elevated at the sharp angle is too much, slide the mat or whatever you're using away from the wall and get the knee to a range of motion where you feel comfortable through the joint. If this is still too much, what you can do is put both hands on the floor in front of you just to take some of the pressure off the thigh. As you increase your mobility, you can start to climb the hands up onto the thigh and even stay flexed forward. And then as you feel more and more mobile, you can open the upper body up. I would stay in a couch stretch for 60 seconds on each side, and if you have quite a bit of knee discomfort, I would repeat for 2 sets. If this is still too much for you, you can use a small elevated foam roller, a few towels rolled up, and elevate your foot just to a smaller range of motion so that you can start to move through the stretch through the quad. Once you've done this, I highly recommend doing a banded tendon distraction for the knee. I found this is really good for repairing the health and movement of the tendon that runs through the front of the knee. So the way that you would do this is you would move out of your couch stretch, you would take a band, and what you're going to do is you're going to start at the very base of the knee. The thing that works best with this is called voodoo floss or even a bike tire. You can use something like this. It's just going to be a little bit more uncomfortable. I bring the band to the base of the knee, and if she was wearing pants, I would do this a little bit tighter. So what I'm going to do is I'm going to overlap the band so that it runs down through the front of the knee, and then I'm going to tie the band together. Again, if she was wearing pants, this would be quite a bit tighter. Now, once you move back into the couch stretch, your knee is not going to be as close to the wall because your range of motion is going to be restricted. So Emily's going to go back down, the banded knee is going to go back towards the wall, and she's going to move this front foot up just a little bit further than she did before. Hands are going to come onto the floor, and then she's going to floss her hip. What that means is she's going to move her hip forward and pause, then she's going to bring her hip joint back to her heel and pause. I would move through 20 repetitions on each side, pausing for 2 seconds, both in the front of the stretch as well as the back of the stretch. The objective of this is that the band is creating some restriction around the tendon and hopefully allowing it to move more freely back and forth. After we finish off all of our mobilization as well as our static stretching, we want to make sure that we're doing some kind of activation to make sure that the joint is being stabilized. First thing I would recommend is some kind of banded side step. These are really good for TFL, IT band, glute medius, and adductors. You double up a band, step into the band, and I would try a variation of position. So position 1 would be the base of the knee. When you do this, you make sure that the band is going to maintain tension the whole time. Bend your knee slightly, stay as vertical as you can, and then you're going to sidestep one direction for up to 20 repetitions. It will burn. Once you go one way, you're going to come back to repeat the opposite side. If you have any kind of knee discomfort in this position, try changing the band to above the knee. And if it doesn't work above the knee, you can go back to around the ankle. If neither of these positions work for you, you can do lateral banded abductions, which has the same objective but will take any tension off the knees. If you're able to do these, 3 sets, 20 reps each direction. If not, you can step out of your band. What you would do is you would stand sideways on a plate or anything elevated. If you're at home, it could be a stack of books. This band could be tied to a doorknob or tied a knot at the end and slammed underneath the door. What you would do is you would stand on your plate, your band, and you would step the band into the outside leg. Once the band is to the outside leg, you're going to bring it just to the knee. And then when doing this exercise, the standing leg as well as the banded leg are both working. You want to stand nice and vertical, tummy is slightly tight, and all you would do is you would pick up your right foot slightly, and you're going to abduct the leg away from the body. And then you're going to come back in, and you're going to repeat 20 reps. It's going to perform the same action and activate somewhat of the same muscles, as well as the opposite VMO on the standing leg is going to be working as well. Once you did 20 reps on one side, all you would do is flip around the other direction and change the band. Once you completed 3 sets of 20 of these, which could also be an addition to your banded side steps, you're going to move into the last exercise called Peterson step-ups. So when you're doing a Peterson step-up, you're going to stand on the outside of your plate or your books. So get your left foot up there. You're going to stand all the way up. It's nice to have something for stabilization, as this movement is all about just moving through the range of the motion of the vastus medialis oblique, which is a muscle that stabilizes the knee. When you're doing a Peterson step up, the opposite foot comes out to align up with the bottom toe. As you're stepping this foot onto the floor, you're elevating up as high as you can onto the ball of this foot. So Emily's gonna put this foot down and she's gonna over-exaggerate coming, say right there, over-exaggerate coming up onto the ball of her foot. Now, coming back off the floor, she's gonna push off the ball of the foot. Perfect. So the most important cues are toe to heel alignment. This foot is coming up off the heel before this foot touches. Perfect, lower down. And then really focus on driving through this toe and coming back up. This is a specific exercise for vascus medialis oblique, and it's really important. Doing 3 sets of 8 reps is perfect. As your strength starts to build, you can go up to 12 to 15 reps. This isn't about getting a burn, it's about moving through the movement efficiently and slowly so that the VMO has time to tighten.